Hello, I'm Caleb Smith, the editor at the Rocket Miner newspaper with your regular coronavirus update for Sunday, March 29th, 2020. According to the Wyoming Department of Health website, right now confirmed coronavirus cases in Wyoming stands at 87. There have thus far been 0 deaths. Breaking down those cases, that's in 15 of Wyoming's 23 counties. That's 1 in Albany County, 1 in Campbell County, 3 in Carbon County, 1 in Converse County, 23 in Fremont County, which is the largest concentration in Wyoming, 1 in Goshen County, 5 in Johnson County, 19 in Laramie County, 9 in Natrona County, 1 in Park County, 6 in Sheridan County, 1 in Sublette County, 1 in Sweetwater County, 14 in Teton County, and 1 in Washakie County. Earlier in the day, when the number sat at 86, the state was reporting that 20 patients are fully recovered. And like I wanted to repeat, Wyoming's fortunate in which that there's been 0 deaths in our state thus far. Looking at information from the Sweetwater County COVID-19 Task Force, Castle Rock and Green River has been announced as a second official collection site. Those who think they've been exposed to COVID-19 or you've got fever and other symptoms as of a cough or difficulty breathing. I've read some stories where it talks about people feeling like there's someone sitting on their chest. Call Castle Rock Medical Center, or you can also call Sweetwater County Memorial Hospital for medical advice. Please do not just go to Castle Rock or Sweetwater Memorial. Call ahead, talk to the experts. They'll tell you the best way to proceed. Right now, Sweetwater Memorial, Castle Rock, and Aspen Medical Center are continuing to work together to explore and present a combined coordinated response. It's also looking at patient or potential patient overflow issues. According to the county report today, the state health lab is now turning around results to local officials on average within 48 hours. That's a much quicker turnaround than we'd heard that they were not too long ago. Additional shipment of personal protective equipment, or PPE. If you keep hearing that acronym and you're like me, you have to wonder what that means. This additional shipment of personal protective equipment has been delivered by state officials and being distributed through the county public health to all area emergency first responders and agencies. One of the things that the county report wishes to stress, they actually put this in bold, and I'm going to read it direct. We would like to remind the public that testing for COVID-19 using the test kits provided to local providers by the state health department is free of charge to the patient. In addition, if you're sick, there's a couple questions that they want people to go through. If it's something that you can just handle at home, if you're suffering from something that's a non-COVID-19 related illness, the general advice is to stay at home sick. That said, let me put an asterisk there. They stress that don't be afraid to call your medical provider or a healthcare provider to arrange treatment. They do have alternate evaluation and treatment methods in place in case that somebody's coming down with something that needs to be treated directly. They stress in all capital letters, please don't suffer alone at home thinking that treatment is not possible. We're having to come up with variations on how we've been doing things. Another piece of news that came down the pike today is that President Donald Trump announced that it looks like we're going to be extending the federal guidelines for maintaining physical distancing through at least the end of April. Earlier, He had voiced the hope that we might be able to have these things wrapped up by Easter. And while it would be wonderful if it still turns out that way, the word from the White House is right now that it looks like that we need to be aiming for June 1st. And in general, if you feel like, for the sake of your family, for your loved ones, for your circle, you don't have to wait for others in authority to up your game. If you want to limit your own interaction, if you want to go out only when it's absolutely necessary, that choice is yours. I'm trying to do that the best I can. I know many others who are struggling with it, but still trying to do the same. We're all in close quarters. We're all feeling probably a little bit more claustrophobic than what we normally would be. When just not that long ago it was like, let's go to the movies, or let's just go out for a quick bite to eat. And while there's still curbside service, and God bless streaming services that still let me get a daily dose of regular movies, we have to keep our heads screwed on straight. One of the things that they've stressed that in the past is that often there's been a second wave of the virus after the initial all clear is given. As we kind of relax our standards, suddenly we're not washing our hands quite as much as we were, might be sneezing in the less safe way, or not being as quick to wash your hands. I still do the wipe off my hands on my shirts, and that is most definitely not sanitary to the degree that it needs to be. Take it easy on yourself as much as you can. We're going to need to have a lot of patience and forgiveness for one another. But we're going to make it through this. We're all in this together. Whether it's individuals or families or as a community, we're all looking for ways to show support. Whether it's teddy bears in the windows, free tests through the State Department of Health, or just strong words of advice and encouragement from hopefully people like me or other people in your life. And if you're not hearing that voice, I'd strongly encourage you to call people. Be that voice. Start putting it out there so that other people are getting it from you. You might be surprised how it turns back around. So this has been Caleb Smith with the Rocket Miner newspaper with your regular coronavirus update. Wishing you a good Sunday night and a safe tomorrow.